Welcome. Today we're diving into a less commonly discussed, but impactful condition that often comes with age-related vestibular loss, also known as presbyvestibulopathy. While we often hear about vision and hearing changes as we get older, the vestibular system, responsible for balance and spatial orientation, can also decline. Let's explore what this means, how it happens, and what can be done about it. So, what causes presbyvestibulopathy? Unfortunately, the exact cause is still under investigation. However, it's believed to be a multifactorial process linked to the gradual degeneration of the structures within the inner ear responsible for balance. This can include a loss of sensory hair cells in the vestibular organs, atrophy of the vestibular nerve, and changes in central vestibular processing within the brain. Contributing factors can include genetic predisposition, vascular issues, exposure to ototoxic medications, and even prior inner ear infections. Let's talk about the pathophysiology. The vestibular system is a complex network of structures in the inner ear that detects head movements and orientation. These structures include the semicircular canals and the otolith organs. As we age, these structures can experience a gradual decline in function. The loss of hair cells in the vestibular organs reduces the ability to detect head movements accurately. The vestibular nerve, which transmits signals from the inner ear to the brain, can also atrophy, weakening the signal strength. Finally, the brain's ability to process vestibular information may become less efficient, further contributing to balance problems. When it comes to epidemiology, age-related vestibular loss is more common than you might think. Because it's often underdiagnosed, it's difficult to pinpoint exact numbers. However, studies suggest that a significant proportion of older adults, particularly those over the age of 70, experience some degree of vestibular dysfunction. This can contribute significantly to falls and mobility issues in the elderly population. What are the signs and symptoms to watch out for? The symptoms of presbyvestibulopathy can be subtle and develop gradually. Common complaints include a sense of unsteadiness, difficulty walking in the dark or on uneven surfaces, a feeling of being off balance, and an increased risk of falls. Some individuals may experience vague dizziness, lightheadedness, or vertigo-like sensations. Because these symptoms can also be attributed to other conditions, it's important to consult a healthcare professional for a proper evaluation. How is age-related vestibular loss diagnosed? A comprehensive evaluation is crucial. This typically involves a thorough medical history and physical examination, including a neurological assessment and a balance evaluation. Specific tests, such as videoanastigmography of VNG, caloric testing, vestibular evoked myogenic potentials of VMPs, and rotary chair testing, can help assess the function of the vestibular system. These tests help determine the extent of vestibular loss and rule out other potential causes of balance problems. Age-related vestibular loss doesn't necessarily have strict types, but rather different degrees of severity. Some individuals may experience mild balance issues that barely impact their daily lives, while others may suffer from significant instability that greatly affects their mobility and independence. The presentation can also vary, with some primarily experiencing gait instability and others complaining more of dizziness or disequilibrium. While there's no cure for age-related vestibular loss, there are effective strategies for treatment and management. Vestibular rehabilitation therapy is a cornerstone of treatment. VRT involves exercises designed to improve balance, coordination, and gaze stabilization. These exercises help the brain compensate for the reduced vestibular function. Assistive devices, such as canes or walkers, can also provide added support and stability. Medication may be prescribed to manage symptoms like dizziness or nausea. Creating a safe home environment by removing trip hazards and improving lighting is also crucial. Can age-related vestibular loss be prevented? While we can't completely prevent the aging process, there are steps that can be taken to potentially reduce the risk or slow the progression. Maintaining a healthy lifestyle with regular exercise, a balanced diet, and avoiding smoking can promote overall health, including the health of the inner ear. Managing underlying conditions such as diabetes and hypertension is also important. Being cautious with ototoxic medications and protecting your ears from loud noise exposure can further contribute to preventing inner ear damage. What about the prognosis and recent research? The prognosis for individuals with age-related vestibular loss varies depending on the severity of the condition and the individual's response to treatment. With appropriate management and vestibular rehabilitation, many individuals can significantly improve their balance and reduce their risk of falls. Current research is focused on developing new diagnostic tools, identifying potential therapeutic targets, and exploring regenerative therapies to restore vestibular function. Understanding the underlying mechanisms of age-related vestibular decline is crucial for developing more effective interventions in the future.